I'd been searching for a dog for a long time, and my husband knew that I was in the market for a dog. We both were, and there was an ad in the paper for some bloodhounds. So we spent the afternoon driving out there and playing with this. I think there were 12 puppies. There was one that just wouldn't leave Neil alone, so that's the one we picked, and we named him Cyrus, I think on the way home. He spent most of his life just swimming in the rivers and lots of hikes. When Cyrus was about 12, he was acting like he felt okay, but he just wasn't eating, and his neck was very lumpy. So we talked to the vet, and they said, well, bring him in because it could just be an infection that he's fighting off. But if it's not that, it could be more serious.
They were very stressed when they first came in. They had just been told by their family doctor that their dog had been diagnosed with lymphoma. It's very analogous to non-Hodgkin's lymphoma in people. And at that time, we basically talked about the standard of care chemotherapy, the prognosis and what we would achieve with that. We also did offer them the opportunity to participate in clinical trials to not only potentially choose drugs that would help Cyrus, but potentially improve cancer treatment with lymphoma in other dogs and potentially humans as well.
So like humans, dogs get cancer. In fact, most dogs die of cancer. And many dogs are as meaningful to their families as children are. And so a lot of families want to make the right choice of chemotherapy agents when their dog has cancer.
The way the Woof For The Cure process works is we microinject 8 different drugs using our clinical SIVO device. And we do this in a way that delivers just a small core of drugs to the tumor. These are minuscule doses, less than 100-fold of the typical dose that you would give systemically. And so then what we do is come back 2 days later, and then we surgically resect the tumor and process the tissue in a way that allows us to look at the different drug responses in that tumor.
Everything that we do for human patients is because we've learned so much from working with dog patients. All the way from the design of the instrument to how we track exactly where the drugs are in the tumor, to how we interpret the data and make clinical decisions.
The SIVO clinical device is in patients right now. And really the whole process ultimately is going to be about identifying which drugs we think make sense to treat the patient with and which drugs really would be foolish to treat the patient with.
The people at Presage, they had asked me for a photo of Cyrus after he passed away and after the research was well underway. And so I sent them some, but I kind of didn't think a whole lot about it afterwards. But when we got to see their research facility, there's a giant picture of Cyrus there as #1 dog and 15 or 16 other dog photos next to it. It really does give Cyrus a legacy, and it's neat that the Presage people honor that and that it's important to them like it is to all of us.
People who enroll in clinical trials talk about being patient #1, and Cyrus was dog #1. He was patient #1 who was the very first to have this technology applied. He started us on a trajectory of changing the way we practice oncology.